Greetings, everyone. Dr. Smith here, and I'm very excited for our presentation today. We're going to be covering what I think is the most important and fundamental aspect of holistic medicine, natural healing, alternative medicine, whatever you want to, whatever words or terms you use to describe it, other medicine from conventional approaches of pharmaceuticals and surgeries. And my goal for you is to come away from this 60-minute presentation with two things. One, an appreciation of how your body is self-healing, intelligent, and wants to be healthy. And two, how this impacts our experience and our understanding of our symptoms and what they can tell us, and how a basic holistic approach actually makes sense as something entirely different from other medical approaches. This literally is how you will become your own doctor. It is that important. So I'm going to share my screen now and we're going to jump into this. All right, so you should be seeing my screen now. We're going to be discussing two things today, and they're very much intertwined. One informing the other in how we understand both of them. So we're going to talk about vitalism, and I think you're going to get a better understanding of how your spiritual beliefs are actually very much in alignment with how your body works. And this is likely something that you've been frustrated with the traditional or conventional medical approach before and hasn't made sense to you, that the conventional medical system separates these two from one another. We're also going to dive into the philosophy of disease. And don't be scared. I'm not going to get really theoretical and philosophical here. I'm going to keep this as simple and straightforward as I can. My intention is not to simply give you a bunch of theory, but to show you how drastically different a holistic approach to disease is, and that disease is not something that just happens, but as something that has a real process and how that process actually works. So we're going to keep this at a level that hopefully will make sense to you on a day-to-day basis and impact all sorts of ways that you relate to yourself and your health. So I'm super excited about this. And the layout for today is going to go essentially like this. First, we're going to cover some basic assumptions of holistic medicine. And I urge you to write these down, these assumptions that we're going to go through, along with any notes or ideas about these things that are personal to you. And of course, any questions that you have along the way, jot those down, and we'll try to get those answered for you at some point. So next, we're going to specifically define the term vitalism. Then we're going to look at a map of disease and dive into how disease actually starts and grows as a process and not simply as something that happens to us randomly. Then we're going to talk about what actually creates health. And I think that this is going to be very interesting to you, as there are many things that you've already learned or will be learning soon, as well as items that are simply out of your control but need to be considered. And then lastly, I'm going to outline how all of this information and understanding actually impacts how doctors practice medicine clinically. So that when you talk to someone like me and we give you recommendations, you'll understand more of what these recommendations are meant to do and why there's so often many things to do. So before we jump into this, let's take a breath together and settle into this. In through your nose, feel your breath expanding in your abdomen, feeling your abdomen fall as your breath exits your nose. And pause there at the end of your exhalation, just briefly. A moment to collect yourself. And then allow the next breath to easily flow into your nostrils and down into your belly. So the first thing that we have to understand is that your body is self-healing. And your body being self-healing means that you are a self-organizing organism, capable of creating balance inside of yourself. Your body is able to regenerate cells, tissues, even organs. Your body is able to repair damage that has been done to it over the years. And your body is intelligent and wise. And this is incredibly important to understand because your body actually wants to be healthy. It has an intelligence that is pursuing this and trying to direct your attention to bring about this health, this balance. And we're going to talk a little bit more about how the body uses symptoms to communicate with us about what it needs a little bit later. But for now, let's jump into some of the basic assumptions of holistic care. So the reason why it's so important to acknowledge that our body is ordered and intelligent is that when we look, the reason why it's so easy for us to acknowledge that our body is ordered and intelligent is that when we look out into the world and in nature, we see that the universe is ordered and intelligent. It's interconnected. It's wise. It's also benign. And by benign, I mean that the universe actually wants to create life. There are violent aspects in nature, of course, but as a whole, the essence of life is to be alive, to be in balance and harmony with other life as a cycle or a synergy, a plan, or however you want to look at it. So that brings us to our second assumption that health is actually our natural state of being. It is natural and normal to be in health, to exist as a healthy person, and all other options are actually a deviation from this normal or natural state. And maybe there's some struggles with that idea, but just bear with me, because if health is our natural state, which it is, then why did disease happen? So our next assumption states that ill health or sickness of any kind is an adaptive response to a disturbance in the system. And we're going to talk about the different levels that this can happen on or at in just a minute. But consider that if we have a natural state of health, that health is our set point. Then when there are forces outside of our control that happen, or maybe they are within our control, but they still disrupt this natural state, what our body does is adapt to compensate for those disruptions. And it's these adaptations that we see as ill health. So then the return of normal health would be brought about by removing those elements that are disturbing health. And I hope that makes sense. So if our body is self-healing, that if it is ordered and able to regenerate and repair itself, if we take away what's causing those problems, take away those disturbing factors, then it stands to reason that our body will be able to bring itself back into health. And that is what we see. And we're going to talk a little bit more about how that works. Because I have a sense that there's already some questions about how this relates to chronic conditions And we're going to address that specifically in just a little bit. So the last assumption is that the appropriate treatment should always involve the least amount of force necessary to restore health. So this means if eating some ginger to soothe an upset stomach is good enough, we shouldn't take a proton pump inhibitor. Or if changing our diet will work for correcting blood sugar imbalances or weight loss, we shouldn't take prescription medications or have lap band surgery or anything like that. So I said that we were going to talk about the different levels that things could be disrupted at to bring our body out of balance. That the body becomes sick when there is a disruption that happens, and then the body adapts. And there's an idea that we're made up of more than just our physical body. And this idea, it adds some complexity to these disruptions. So most people understand this idea that we have a mental or psychological component to our experience of reality. And we have a physical component, and we have a spiritual component of our experience of who we are. And I understand that many people explain this terms of spirit and soul being two different things, and this is not a theological conversation. So I'm leaving it with just this simple Trinity model. But whatever your model of this is, the bottom line is that all of these levels or aspects of our experience of reality, they all come together to create our sense of self, and they're all interconnected. And so a disturbance in one will cause adaptations in multiple others. Okay, so an example of this is when we have an auto accident and become physically injured. And we have a physical experience of pain, immobility, potentially changes in our digestion, sleep pattern, appetite. But we also have mental, emotional effects too, where we feel depressed and lethargic. We have thoughts of, maybe this is never going to end, and then slip into a worse depression. And then potentially we have a spiritual component. Well, we have a spiritual component to all this, but potentially that spiritual component may help lift us out of this downward spiral and have a more positive attitude toward things, that we can actually help our situation. And then perhaps our pain becomes less, because it's well known that pain and emotional state are intimately related. But then on the other hand, maybe our spiritual understanding is not helpful, and we become to believe that this happened to us because we deserved it or because it was fate. And in effect, our spiritual belief actually supports our ongoing or continued depression. And so that's just a simple example of an auto accident and how it immediately can relate to these different levels of our experience. And we could create a pretty complicated map of how these levels of ourselves, mind, body, spirit, relate to virtually everything that happens in our lives. We could show that they either support ourselves to be in health or out of balance, and then support an adaptive response. And so, and if you're not fully understanding the adaptive response piece just yet, don't worry about this. We're going to look at a diagram in a bit that's going to really bring that point together. But for now, it's just important to acknowledge that we have these elements, these levels, mind, body, spirit, that are all working together to bring balance and health into our lives, and that there can be different things that can disrupt at these different levels, and that they can impact the other levels. So a disruption in one level will inherently or naturally disrupt other levels. Just as they can be disrupted with different things, one of these levels can also impact the other in positive ways, right? So, and bring the whole system back into balance in some cases, right? An example of this would be how prayer or epiphanies happening can literally change a person's life forever. Or this could be maybe a change in mindset, or even how concentrating on exercise can help change our mental and emotional state, right? Or how food, when we start to eat better, we change our mental state and our emotional state as well as our physical state. And so one element at one of these levels has also positive effects on all of the other levels as well. They're very intimately related. So, and I know that there's people that you're saying, come on, Dr. Node, that's some pretty woo-woo stuff you're talking about. This connection between our mind, body, spirit. And this connection between our thoughts, emotions, and real physical symptoms. I'm like lung disease and cancer and pain and autoimmune conditions. Yeah, like autoimmune conditions. The link between our thoughts and emotional state to these other things is pretty cutting edge research. And the area of study is referred to as psychoneuroendocrinology, or the study of the relationship between our brains, but more specifically our thoughts and psyche, our psychological aspects, and our nervous system and our hormones. So how those three things are all related. This is a pretty established area of research. And then there's also an area of research called psychoneuroimmunology, which studies the effect of all of these things on the immune system. So this is real stuff. Our bodies are absolutely amazing, and your feelings, your intuitions on how all this stuff works is likely more right and correct and accurate than you might give yourself credit for. I talk with a lot of clients and ask them, what do you think the reason for all of this stuff, your symptoms, your gastrointestinal complaints, your chronic pain? What do you think the reason for this is? And they often look at me a little bit shyly and then tell me a story about how, someone died, or they had a really bad breakup, or they'd been moved across the country or started a new job that was super stressful. And all of the symptoms kind of started around that time, but they've never really been told that makes sense. They've kind of been told the opposite, that these types of things can't impact physical symptoms. And they definitely can cause physical symptoms, and they most certainly can be the straw that breaks the camel's back, so to speak, and brings everything to the forefront to be dealt with. So at this point, we've covered some basic assumptions about how the body works. And I have a feeling that much of this is probably how you have thought about your body before, but maybe just felt silly because it's not sciencey enough, or you feel like the research doesn't support this. Well, let me tell you that the conventional medical system has a lot at stake to keep you thinking that they're the only ones who know anything about health and your body. But, we're trying to change that way of thinking. And I hope you're starting to see how much power this actually gives you once you understand how the body works in this way. So now we're really going to deviate from the conventional medical world. And I think that I might lose some people. And that's fine. But because before we continue, I'm just going to say that all these basic assumptions absolutely work, regardless of whether you agree with this next component of the presentation. So our bodies do work like this, but I want to give just a little bit of further power to this idea. So vitalism is vitalism is the opinion that a force, neither chemical nor mechanical, is responsible for the phenomenon of life. That you're not merely a sack of bones, neurotransmitters, hormones, skin, tissue, chemicals, you know, and most people believe this. And, you know, whether how you conceptualize this, you know, whether this is how the natural world works with a divine consciousness, or how the world or how the universe is organized as a whole, or whether you're in nature and you just know that there's some force working behind the scenes, you know, or, you know, whether you're Christian or Jewish or Hindu or Muslim, all faith traditions believe in some sort of ultimate force at work in the world. And I'm not going to get into the history of medicine here, but it's a relatively new thing that medicine and religion, or medicine and spirituality, have been considered as separate things. For most of human existence, the two have very much gone hand in hand. And so the implications of this are huge for health, that the spiritual realm, or this ultimate consciousness or force in the universe, is very much related and connected to our physical bodies. And if this is part of our belief system, then it further supports this connection. Okay. And it supports that there are natural laws. They're simply mandates of how the natural world works, which also transcend the physical level and operate on those mental and emotional and spiritual levels, but also in how the natural physical world works. And going against those natural laws will have consequences. But as we've already spoken about, we can come back into balance by returning to those natural laws. And so here's another way of explaining where we're at right now as we transition into how disease works as a process. That health is not a matter of chance. That there are determinants of health. There are things that we can do, things in the world, things that happen to us that will determine our health in a very real way. Some of it we have control over, and some of it we don't, and we will get into how that works. And that disease is a process that follows directly from a deviation of these natural laws. So I made this little diagram here for us to go through. And so this is how disease works as a process. And I want to take this piece by piece. It doesn't just happen by chance, and here is how it works. So if we take normal health in the upper left-hand corner here, that's our natural state. And I'm very intentionally not going to say that we're born this way, because many of us are born with genetic deficits and such, and we're going to get into that in a second. But this is the ideal. It's where the body is constantly striving to get back to. Okay, it wants to exist in normal health, in a healthy state. Now, all these possible disturbing factors are happening to our body. And this could be, you're probably familiar with so many of them, but this could be the food we eat, the environmental exposures that we experience, trauma in our lives, different accidents, the kind of water we drink, all of those things that, we know cause a disturbance, but also things that we may not recognize either. Like heavy metal exposure from unknown sources. and things like that. So there's all these disturbing forces happening, and it causes a disturbance of function. So the body as a system becomes disrupted. All right. So that's in the middle there, right underneath the teal arrow. So we have a disturbance of function. Now, the result of this disturbance of function is a reaction. Okay. Now we're going to start getting into things that I think, we can all relate to. So this is where we get acute symptoms, we get a fever, we get an inflammation, we have pain. And this is where it really starts getting interesting, because this is where we become, we're at a crossroads here where we can do different things. We have choices on what to do. And what the body wants to do is discharge whatever is causing the problem. Okay, this is why so often acute illnesses have symptoms like throwing up or diarrhea or coughing, or you have a runny nose or even a rash. The body is trying to expel toxic material in the blood and clean up the system. Okay. So now note that when that discharge process is complete and allowed to happen, we return to normal health. That's the body's cycle of having a reaction and then dealing with the problem, or dealing with the reaction and then returning to normal health. This is why we often feel better. You'll notice this after you have a really bad fever, because your body actually discharged something and you returned to a more normal state. But what happens when we suppress a symptom? We take something to stop the fever, or to stop the vomiting, or to stop the diarrhea, to stop the runny nose. It's a decongestants or something like that. Well, the body doesn't get the chance to discharge those waste products. And the illness, the dysfunction, gets pushed further into the body. And then we begin to get chronic conditions. Okay, this is why people get a rash and then they get digestive problems and then they get rheumatoid arthritis, or they get a rash and then they get earaches and then they get allergies and asthma. Okay, common with children who have these problems growing up, because every step of the way, those symptoms that the body wanting to discharge was suppressed. Okay, now I'm going to pause there for just a minute and add a point to this. So it's important to remember that we still need to remove the disturbing factors as well, right? So like in the case of a rash or the earaches and then allergies, right? Like little kiddos often have this going on. If the kiddo is allergic to milk or gluten or whatever, peanuts, probably not peanuts because you'd know if they were allergic to peanuts, but milk or gluten, or they're allergic to potatoes or something like that, and they're getting rashes, and those rashes are treated with corticosteroids, the food allergy is still there. So the next time the symptom is the ear infection, and then the next time it's allergies and asthma, because that disturbing factor is never removed, right? And so it's not just a matter of letting the discharge process occur, because we still need to remove those disturbing factors. Okay, so and then the discharge process must be allowed to complete. So we have to remember that the body is wise and intelligent and actually knows what it's doing. So we need to learn how to interpret these symptoms as the body telling us something is wrong, instead of merely looking for something to take away the symptom. Okay, so now going back to the chronic condition. So once we're in a chronic reaction state, okay, so this is where a reaction has not been allowed to discharge, okay, and the disturbing factors are likely continuing to happen. Then notice that we can go both ways here, right? We have two arrows. We have an arrow that is going back and forth from the reaction, okay? Or we can go further into degeneration, okay? So this is the part of the diagram, and this is the part of the process that I believe is the most crucial to understand, because likely you're in the state. Once we get to middle age, we're dealing with chronic problems, probably for some time. Your system's been feeling run down. You're not functioning optimally. There's been symptoms that have been suppressed over the years. And, even if you're not in dire straits, which, most of us aren't, we still have years of life on a planet that is full of toxins in the air. We're, not doing detoxification periods regularly. So we're in a chronic state, but we can go back to health. And that's the cool part about this. So check this out. What has to happen first? Well, first we need to go back to the reaction state and have a discharge. And this is where oftentimes healing from chronic conditions or symptoms that we've been having a long time can become very uncomfortable, because there's a natural reverse of the progression. So I often say this, that you have to walk out of the forest once you've walked into it. So if you've spent years taking decongestants and corticosteroids or proton pump inhibitors or pain relievers for inflammation, there's a likelihood that you're going to have to return to some of these symptoms, that some of these symptoms are going to come back along your road to health. But here's the good news. These symptoms are usually very short-lived. They're intense. They can be very intense, but they don't really last so long. And your overall disposition and energy level, emotional state will be, as a whole, will be improved. So, and this is why I often check in about digestion during the detox and why it's so important that you're going to the bathroom, because you need to be getting rid of the garbage that comes up as you're detoxing. It will make all these healing reactions less intense. And common healing reactions are it's the way that you get your health back. Rather than the difference between the healing reactions and a disturbing factor are usually you know this because you're doing good things for yourself already, and then your emotional state will tend to be in a positive trajectory. And common symptoms will be, inflammatory states. There'll be fevers, skin rashes, diarrhea, other discharges will happen. And these headaches are common. And even mental emotional states can discharge too. It's not uncommon to have a return of irritability or anxiety as you're detoxing and as your body is moving from a chronic state into a reactive state and then discharging back to normal health. And this can take years. You might have different plateaus and different cycles where different disease states that have been locked in the body for some time finally unravel themselves and then discharge. So the final part of the diagram is that is important to understand is that if there has been degeneration in the system, for instance, if you've had type 2 diabetes and the pancreas is actually not functioning because it's been damaged from years and years of high blood sugar, then it's going to take a bit longer to recover. And the disturbing factors, they have to be removed, obviously. And the actual organ, so in this case, the pancreas, in the case of diabetes, would likely need to be supported. It's not that the body cannot heal it alone, but when there's actually damage that's occurred, it's very helpful to support the body with various nutrients to speed up that process, but then also account for the fact that we do live in a pretty toxic world, and not all of us can simply go to the mountaintop and have pristine environmental conditions when we're trying to heal. So this is a time of patience and understanding when we're working with degenerative and chronic diseases too, and acknowledging that when you get to a point where you're actually having intense acute symptoms again, it is likely a good thing. And it's a sign that you're on the right track, and certainly important to not take any suppressive therapies that will then stop that process and push those discharges back into the body. So it's really a simple process, actually. Don't try not to overthink it. And we're going to come back to it one more time in a little bit, but I want to transition to what actually determines health. What are each of the things that can be a disturbing factor? So these determinants of health are the elements of health that we need to consider when looking at possible disturbances in the body. Okay, so genetics, intrauterine influences. So that's like what's happening when you're in utero, like your mother's pregnant and you have not been born yet. And then there's birth trauma. Okay, your spiritual life is a component that determines your health, as we've discussed already. Nutrition and digestion, emotional stress and traumas, relationships, physical stresses and traumas, and exposures. That would be like exposures to environmental toxins and things like that. Physical strengths and weaknesses, illnesses, and then illness consequences, and also addictions would fall into that category. And then medical interventions like surgeries, drug effects, and then the suppressions, the suppressive treatments. And you're probably thinking right now, well, I can't control like half of those. And you're absolutely right. So the determinants fall into three categories: the born with and maternal factors, disturbances, and then how we live, okay, or our lifestyle hygiene. So the inborn or maternal factors, these are elements that we're born into life with and have virtually no control over because, of how our parents lived or how we were raised. And these would be like genetics or intrauterine or congenital defects, maternal exposures. Okay, so if your mom smoked or did drugs or was on prescription drugs or on, had exposure to toxins, or she got a virus when she was pregnant, and also her psycho-emotional state, like what was going on in her personal life during pregnancy. These things significantly change the health of the placenta, the health of the fetus, and will change the way that we're born, what we're born with. Also the maternal nutrition and the overall maternal lifestyle, whether your mother was active and healthy or not. And then we all are born with an overall constitution. Okay. And all of these factors that I just listed off will contribute to that constitution. But once we're born, kind of have a constitution and a personality. And this relates to what we were talking about in terms of vitalism and how there's a force that governs the universe, and how you choose to look at how we are born into the world in terms of our personality and our purpose and our potential. That would, fall under this category of our general constitution. So, and then also we have these disturbances that we really don't have control over. So when I say illnesses and sequelae, that's like, if we have a really acute illness as a child and then consequences of that illness, then we might not be able to really control that. For example, if we have recurrent ear infections and then tubes put in our ears because of a dairy allergy, ultimately the determinant of health that was out of balance was nutrition in nature. However, the illness, the ear infections, and then the surgery created an additional layer of disturbance to our health that we'll have for the rest of our life, and we didn't really control for that. So this would account for illnesses that we have while we're also in a chronic state. So it's not only when we're children, but if we're in a chronic state and have an illness, sometimes those illnesses can have devastating consequences. So this actually is this scenario with the COVID pandemic right now, where the current state of health, where if the current state of health is not good enough to be able to handle the illness, then the illness becomes a significant disturbance that must be considered separate than just a simple reaction. Okay. So this is why it's so important to get our health back, so that these illnesses aren't as dangerous to us, that we have a resiliency. So then also physical and emotional traumas and stresses as we're growing up and don't have really the ability to regulate, that we're still learning how to do that. And then toxic and harmful substances that we don't have a choice to be around. And then allergies and maldigestion as children, and how those are handled will all be contribute very significantly to our health. So then there's all of these elements of health that we do have direct control over. Okay. So fresh air, clean water, exposure to light, exposure to nature, socioeconomic factors, spiritual health, culture, rest, exercise, nutrition, clean, pure, unadulterated food, loving and being loved, meaningful work, community, stress, and that's emotional stress too, and trauma. And I know that some of these things on the list, you might think, well, I don't really have control over that, but they're things that the human organism has control over. So they're factors that we can, that we can change and have a direct effect over our health. So in addition to that list, I think that list is fairly intuitive for you. But here's a list of some essential determinants. There are elements of our health that are absolutely crucial to have for health at a foundational level. It's because these things interact and affect how our body operates and performs its most basic functions. Okay, so digestion and stomach acid production specifically, okay, that we need our stomach acid to be able to break down proteins, to be able to absorb certain minerals and vitamins. We also need to pay attention to our thyroid and our adrenal function for our energy level and our metabolism. Our liver function is so important to have operating optimally, because it's responsible for our hormone balance. It's responsible for how we metabolize fats, as well as detoxify and cleanse our blood. And then there's vitamins B, C, D, and then minerals, zinc, selenium, iodine, calcium, and magnesium, that are so important for so many cellular functions that they just have to be included on this list. And when they are deficient, we certainly notice pretty significant effects in the body. Our salt or electrolyte balance needs to be considered. And then clean water and exercise are absolutely essential determinants of our health. And we really need to be drinking clean filtered water, reverse osmosis water or distilled water, water without chemical contaminants, water without chlorine in it, water without fluoride in it. These are important things to take into account. So now I want to go. I sense that there's a question of like, how does this all kind of change? Like, what do I do when I get sick then? So I want to jump back to our diagram about disease and actually discuss how this changes how to think about getting sick. And I'm not going to cover exactly what to do when you get sick, okay? Because that would be an entirely different topic, a different presentation, which I will get into. I think that it actually will be the next presentation, which we'll talk about. Well, I think we'll talk about fasting at the next presentation, and then we're going to talk about acute illness. So this will serve as kind of a triad of presentations, which will essentially build the entire foundation of how to be your own doctor, essentially. But here goes for acute conditions. So when we have an acute illness, and an example of this would be a flu, a cold, and I want to add this to the mix here, like a hangover would also be an acute condition, right? The body's response to alcohol poisoning, or a headache or stomach infection, anything that we kind of get. So right away, we have to distinguish this from a chronic condition moving to a reaction, which would be good. That would be a healing response, right? And like I said, you'll know if this is happening because your energy level will likely be higher. You'll generally feel better, and you'll be doing healthy things that would tell you that this is the scenario. Okay. So, but we're talking about the case of like, you just get the flu, there's a flu bug going around, there's a cold going around, and you're going to have a reaction. You're going to get a fever. You're going to start sweating. You're going to vomit. Maybe you'll have diarrhea. You're discharging. You're discharging those toxins out of your blood. You want to let this happen, and you'll soon be back to normal health. Okay? That's just how this works. So what should you do? Well, you want to support your system. You want to ensure that you're properly hydrated. That's the danger of diarrhea, and the danger of fever is dehydration. You want to ensure that you're getting fresh air, that you're moving your body if it's appropriate and you can. You want to be doing things that will support your digestion, such as fasting or eating nourishing foods, depending on what the condition is. And what you don't want to do is suppress the symptoms by taking a pain reliever, a decongestant, a steroid, or any other pharmaceutical. You want to ideally rest and allow your body to heal instead of forcing the symptom away. So support is the name of the game here. And, teas and baths and sleep, Netflix, naps, those are the things that are important during an acute illness so that we can get over it as soon as possible. And there's different hydrotherapy treatments as well, depending on what the condition is. So now, what happens when you're in a chronic state and you're doing good things for yourself, and then you have a reaction? Okay, so you're having the same symptoms potentially, but you're in this chronic state and you've been doing good things for yourself. You're detoxing, you're eating well, you're removing these disturbing factors, and you have a healing crisis. Well, the first thing, just like before, we need to determine if this is an acute sickness or a healing crisis. So if your energy or other things are getting better, your emotional state, your mental state are good, likely this is a healing reaction. Okay, if the upward trend is positive, or if the trend is positive, then it's likely a healing reaction. And also, if this is a condition that you've had before and you have suppressed and now it's returning, this is very likely a healing crisis and should be monitored with curiosity and interest. Are you less anxious about it? Do you have a feeling that it's not really a problem? These are all signs that it's a healing reaction. And typically, healing reactions will be intense and short-lived. You'll not need to do really anything for them. They're going to resolve on their own. And you can support the body through them, with hydrotherapy, with teas, with different herbal therapies that might be indicated, rest. But they often will be intense, they'll be short-lived, and you'll likely feel like you can go about your day to a semi-normal extent. Now, if you've been sick for a long time with multiple different complaints over years or decades, or taken a lot of prescription medications over the years, it's not uncommon for one healing reaction to blend into another for a series of days or weeks, especially over a detoxification period or a fast, and or have different cycles and periods of these healing reactions happening. Maybe you'll have one this month, and then 2-3 months later something else will happen as your body is healing. You should notice that your mental emotional state is improving during this time, that you're not feeling as anxious, you're not feeling as depressed, that other things of daily life are just easier. Even though you're in pain, you have a rash, you have a cold, or whatever is coming up, on the whole, you're feeling better. This is important. So the last thing before we call it a day that I want to mention is how all of this drastically impacts the way that a holistic doctor approaches the therapies that they recommend and utilize. So this is super important, because if you understand how these therapies are being used, you will literally be able to act as your own doctor most of the time. Having an understanding of this will also allow you to be able to further your research in specific areas when needed, and then you'll know how that information needs to be applied to a specific situation. Okay, I think it is especially important when we have little kiddos who have an acute illness, who don't really need anything except rest and comfort, and gentle things like teas and hydrotherapy can be so beneficial in most of those cases. So let's look at the order of these therapies. So you'll notice as we go through these that the order of the therapies is very much the opposite of what you might find in the conventional system. And that's kind of, if we remember back to what I said at the beginning, we want to use the least forceful treatment. Okay, so the first thing that we have to do is we have to deal with any acute problem. Okay, and that's generally not what we're talking about. But if there's an acute traumatic injury or a seizure or acute liver failure or kidney failure or heart attack, all that needs to be addressed first. That's not really what we're talking about here. But for normal illnesses, we want, for chronic illnesses, for what 70% of the population is struggling with on a day to day, we want to identify what the problem, what the cause of the problem is, like a dairy allergy or toxic exposure, and we want to remove it. Now, this would also be sugar, caffeine, alcohol, processed food in the diet. We got to remove all of that. Okay. So that's the first thing we got to do. And then once the disturbing factor, so that's why we do elimination diets. That's why, I utilize food intolerance testing so that you know what foods are bothering you and can eliminate them. So that's the purpose of an elimination diet, is to know that and to learn that for yourself so that you can keep away from foods that bother you. So some foods are always going to be a disturbance, such as sugar and alcohol and caffeine. Okay, now, of course, those things can be utilized in moderation, but it all depends on what your health status is. Okay, as to what effect or consequence those things are going to have on your body. So once the cause of disease has been removed, we have to create a healthy regimen for ourselves. So, and this makes sense. We need to be eating nutritious food, moving our bodies, getting into nature. We need to be spending time with loved ones. All these determinants of health need to be addressed. Okay, so number 3 can kind of sort of overlap with a healthy regimen, because many of the things in a healthy regimen will also stimulate the body to heal. But there's also things that you may not automatically think about, such as breathing, okay, or addressing your healthy digestion, okay, or healthy sleep, or using hydrotherapy treatments, the hot and cold contrast therapies that I always talk about. Those are things that will stimulate the self-healing mechanisms. Okay, detoxification is something that stimulates the body's self-healing mechanisms. Okay, so these top 3 items are what I refer to as establishing the basis for health. They're the elements that are needed for a foundation of health to exist. Okay, so after those are all taken into consideration, and I say consideration because sometimes we need to jump to the 4th or 5th level first, but we still need to consider the first 3 always. So once we're at level 4, we're starting to actively support damaged, congested, or weakened organ systems. So an example of this is the use of supplementation during the detoxification phase. It's important to use supplementation to support the liver and repair the gut lining so that waste products are removed out of the body more efficiently, and also that nutrients are more easily absorbed. Okay, it may be possible for this to happen without supplementation, but it does take longer, and other factors such as a willingness to spend that time on a more restrictive diet, or the ability to fast, or the degree of liver congestion, all make supplementation a very logical choice for most people. And this is just one example. So once we've supported our weakened and damaged systems, then oftentimes there's structural issues that need to be addressed. So such as spinal subluxations or a dysfunctional joint. And it may be necessary to address these areas with chiropractic manipulation or physical therapy, or even other regenerative medicine techniques such as injection therapies, right? And I'm not talking about corticosteroids here, but something like dextrose or platelet-rich plasma. And this is getting into more forceful therapies here when we're in the when we start going to 5, 6, and 7, right? So then if all of these things are honestly considered and utilized, we may come to a time, or the illness may be at such a level that for the health of the person, a suppressive therapy is actually necessary and is the best course of action. So this would be the use of a pharmaceutical or even a supplement or herbal remedy that is specifically meant to take away a symptom without addressing an underlying cause. Okay. And then the last step of the process is, or the last thing that we want to think about is surgical intervention. And that's what I would refer to as the therapeutic order. So I hope that this presentation has helped you kind of understand how holistic medicine is an entirely different path with an entirely different way of thinking about the body than what most of us are taught. And I thank you so much for your interest in this topic, and hope it does help you on your continued journey to health and awareness and health and wellness.